Welcome, everyone. My name is Jess Posner. My pronouns are she and they, and I am the director of the Virtual Y at the YMCA of Central New York. I am a white woman in her mid-30s with brown asymmetrical hair and black-rimmed glasses. I'm wearing a black turtleneck, and the background behind me is a bookshelf and some happy plants over my shoulder. Thank you so much for joining us. I'm honored to welcome you to today's virtual Lunch and Learn seminar, Medicare 101, Understanding Medicare with Erin Cordova. This virtual Lunch and Learn will help you better understand the parts of Medicare, eligibility, enrollment periods, and more. The presenter will also raise awareness about how to spot fraudulent communication so you can best protect yourself and your loved ones. This seminar will benefit those already enrolled, planning to enroll, or assisting a loved one. Our speaker today is Erin Cordova from Aetna. Erin Cordova is a licensed agent who can help you better understand your Medicare options and help you choose the plan, programs, and options that are right for you. Erin has worked in managed care insurance and Medicare for 8 years with 11 years experience in health insurance. She is the only direct Aetna agent in the Central New York area and understands the importance of finding a plan that provides you with value and access to quality care. Visit aetnamedicare.com for more information. And without further ado, I now turn things over to you, Erin.
Hi, thank you, Jess. I appreciate the introduction and all the information and for having us here today. So we are going to go through a Social Security and Medicare 101. It's going to be kind of a high-level overview of just kind of how everything fits together and how Medicare works in general. So you can see we have a little agenda here. So we're going to talk briefly about Social Security, just really what it is, what some of the basic benefits are, considerations you should think about when and if you are going to go ahead and start collecting your Social Security, how Social Security and Medicare actually work together, and turning 65 and still working. And then we'll go into the Medicare 101, where you can see you will be able to, we'll go over the different parts A through D. So we'll talk about how the federal health insurance programs and private plans work together for your Medicare options. We'll talk about original Medicare compared to the Medicare Advantage plans. We'll talk about what dual special needs plans are, also known as DSNP. We're going to cover prescription drug coverage, and of course that that dreaded coverage gap that you probably have heard about with prescription drug coverage. We'll talk a little bit about how that all works, make it a little bit more, a little easier to hopefully understand. And then how you get started, how you can enroll in Medicare, choose additional coverage that's right for you, and we'll look at some frequently asked questions. And then obviously, if anyone has questions, there'll be some contact information at the end for you to reach out for anything further. So we'll start with Social Security. Social Security, and I won't read all of these slides to you, but the main requirement for original Social Security Act was to pay the financial benefits to retirees based on lifetime payroll tax contributions. Now, I'm pretty sure most people are familiar with Social Security. This, of course, was intended for people who have worked and paid into the system to be able to have in retirement. So qualifications to receive full benefits are you must be a U.S. citizen or a resident, and you must have paid into the Social Security system for 10 years, which will also be, you'll probably hear me say 40 quarters. So some of the basics for Social Security, before you apply for retirement benefits, you're going to want to consider, what is your full retirement age? So this is going to depend on your date of birth. This may be between 66 plus 2 months and 67 currently. So we'll go into a little more detail on that a few slides. Now you can start receiving benefits as early as age 62, and your monthly payments may be reduced if you choose to receive benefits earlier. So you may also choose to continue working while receiving benefits. So if you elect to receive benefits before full retirement age, it could affect that. Now, delayed retirement credits may be added to your benefits if you start after your full retirement. So Social Security can be a little complex. We always recommend that you work with somebody who specializes in Social Security, contact Social Security directly. If you are still working, there's just some things that you want to consider, your longevity. How is your health? Are you expected to retire anytime soon? Do you have enough money saved in your retirement accounts to retire early and possibly not take your Social Security until full retirement age? Do you have a spouse and children that you are financially responsible for? Do you have children, of course, under 18 or over 18 in college? So we are seeing more of that these days. So definitely something to consider before you elect your Social Security and when you would like to take that benefit. Now, as you can see here on this chart, it gives you year of birth, and it tells you when your full retirement age is. Currently, for those born in 1957, we're looking at 66 and 6 months. And you can see if born in 1958, they're waiting until 66 and 8 months for that full retirement age. If you delay your retirement benefits until after full retirement age, you may be eligible for delayed retirement credits that would increase your monthly benefit. So this is what most people tend to wait for, is getting to that full retirement age so that they're going to be able to get a higher benefit. So even if you decide to delay your retirement, be sure that you sign up for Medicare at age 65. And we'll talk a little bit more about when and how to do the Medicare portion of it. Now, Social Security and Medicare work together because the Social Security Administration determines who is eligible for Social Security benefits and Medicare. So they also carry many of the administrative functions for Medicare. So you'll see that you will get information from Social Security. You're going to go to the Social Security office to apply for Medicare, or to ssa.gov, or you can call them as well. So Medicare is available to some younger people who have certain disabilities. That's going to be end-stage renal disease and ALS. And then also people who are on Social Security disability for 24 months automatically will receive Medicare as well. So your Part B premium is going to be based on income level. And as you can see the grid here, this is for 2022. Soon we'll be able to update to 2023. Currently, it looks like it may be going down just a hair for some people. You can see the income guidelines there for either an individual or for a filing joint tax return. And also, it's a little different if you're married filing separate, depending on your income bracket. You can see what the Part B premium is for those income guidelines. Currently, most people we see are paying the $170.10 for Part B. I believe it's going down about $5 next year, I was seeing this morning. So not a huge decrease, but it is good to see a decrease for once in that. So Social Security is going to cover Original Medicare Parts A and B. So that is what we call Original Medicare. So Social Security is going to enroll you in Part A. Medicare Part A is going to be your hospital insurance. That helps pay for inpatient care in a hospital or limited time at a skilled nursing facility following a hospital stay. That's the key word there. Now, Part A also pays for some home health care, and hospice care stays with your Part A. Now, for those who have not worked 40 quarters or their 10 years, you may purchase a Part A in 2022. That amount, of course, is going to be a little bit reduced. If you are only partially at meeting your 40 quarters, it would be a reduced portion. And if you are far from meeting your 40 quarters, then you would have to pay the full amount for that. Currently this year, I believe it was about $500 a month if you had to purchase Part A. So most people will not pay a premium for Part A if they have met their 40 quarters, which is really good news. And then you will also be able to sign up for Part B Medicare. Now that is your medical insurance, and that's going to help pay for services from doctors and other healthcare providers. So your outpatient care, your home health care, your durable medical equipment, and some preventative services. One thing I always like to point out with Part B is that even though you may be receiving services at a hospital, such as a outpatient surgery or an MRI, those are going to be considered Part B coverage services if you are not hospitalized at the time. So should you enroll in Medicare if you are still working? Well, there are some rules around how that would work. There is a very nice booklet put out by Social Security. It talks about who pays first. And those are the rules that will be followed if and when you need to decide if you want to take your employer coverage and divert your Medicare at the time, or if you want to go ahead and take your Medicare. Now, if your employer offers health insurance coverage, in most cases, you will want to check with your HR department to make sure. However, most workers should remain enrolled in a Medicare Part A, which is free for most people and is going to cover your institutional care in hospitals, skilled nursing facilities, and other caregiving agencies. Now, this is going to give you, it's with any insurance you have through your employer at the time. So there are certain numbers that usually you have to meet. The common is for people who are turning 65, would have an employer with more than 20 employees on the health plan, and they are able to divert their Medicare Part B in most cases. Again, it's always best to check with Social Security and with your HR department and a trusted Medicare advisor so you can make sure you're making the best decision, because you do want to avoid any penalty. Now, if you don't enroll in Part B when you first become eligible, then you could face what is considered the Part B penalty. It's a 10% premium penalty for each year that enrollment is delayed. Now, if you do have an employer where you're able to keep your insurance and divert Part B, then you will have a special enrollment period at the time that your current employer insurance ends, either by retirement or you choosing to end that insurance. So we also do see people who are working who decide to leave their work insurance and go ahead and take the Medicare. It's really going to come down to out-of-pocket costs and premium and really kind of comparing that for most people. Everybody is different. Every individual is different with Medicare. It's one thing to keep in mind. You will have a different situation than maybe a family member, a friend, or even a coworker. So it's always good to look at your individual situation. See if we can move ahead here. There we go. So we're going to start a little bit more with the Medicare. So we're going to talk about the different parts of Medicare now. So I know this is probably more of the drier material, so I'll try and keep it as peppy as I can for you. Now, Part A, again, we already talked about, is going to be your hospital care, and Part B is your medical care. So again, I can't say it enough, that is what we call original Medicare. Part C is actually the Medicare Advantage plans that you hear so much about. So private medical plans that are typically going to include your Part A, Part B, and most of the time they'll have Part D. And I'm sure you'll see they have many other benefits to them as well. So keep in mind, Medicare Advantage plans are known as Part C. Part D is going to be for your prescription drugs. So Medicare prescription drug coverage plans are available in a standalone or through a Medicare Advantage plan. And we'll talk a little bit more about that in some future slides. Again, there is also a penalty that can be associated with not taking your prescription drug coverage in time as well. And we'll also talk more about that in some future slides. So briefly again, Medicare Part A is your hospital care. Medicare Part B is your medical care. So Medicare Parts A and B make up original Medicare, and they are provided by the federal government. Original Medicare is for people 65 and older and those under 65 with certain disabilities. Again, that is going to be people who are on Social Security disability for 24 months, people who have end-stage renal disease, or people who have ALS. Now, Medicare Part C and D, a little bit more of a summary on them. With Part C, you can buy a Part C plan from a private insurance company. Medicare Advantage combines Part A and Part B and sometimes offers prescription drug coverage. It may include additional benefits like dental, eye care, hearing, or wellness services. You can buy a Medicare Advantage plan, also known as Part C, if you are enrolled in a Part A and Part B and you live in the plan's service area. It's very important to know Part C plans do go by the county of residence that you live in. So they do differ from county to county in some instances, and they do differ state to state. So what is available in another state might not be what you have in this state. So it is important to know that if you move, or if you plan to have part-time residence in another state, or just comparing, you're not going to necessarily want to compare what a friend or relative has in another state versus what you have available in your county. Same thing with the Part D prescription drug plans. They're going to operate the same way. You can purchase a Part D as a standalone prescription drug coverage. So it'll cover just your prescription drugs, or you can have one that is embedded in your Part C plan and it just comes along with it. You do have to be enrolled in Parts A and or B and live in the plan service area. So federal health insurance programs and private plans. Can I just rely on Part A and B and for what the government pays for? So you can rely on Parts A and B, but original Medicare does have deductible and only covers about 80% of your Part B. So if it covers hospital and doctor visits along with some prescription drugs. So it's important to know with Part A, you do have benefit period deductibles for your hospitalization, for your skilled nursing. So those will be out-of-pocket costs, as well as your Part B. Again, you're going to have that 80% that's covered by Part B, 20% that you'd be responsible for. And there's also an annual deductible with Part B. So you do have out-of-pocket costs, and it does not cover your prescription drug coverage. So that is why we do talk about the other parts of Medicare and how they work together. So when you choose a Medicare Advantage Part C plan, it's going to bring in your Medicare Part A and B. So you're going to have that all set. You're going to have the same benefits as original Medicare, and it's going to include many benefits that original Medicare does not cover, such as your dental, your hearing, and your vision. And a lot of these plans today have so many more benefits. You have fitness benefits and over-the-counter benefits. So there's a lot that are being added to them in recent years. Prescription drug coverage, your Part D, is also going to be embedded with most of your Part C plans. So it's not something you have to worry about getting separately. And Part C also has a yearly limit out-of-pocket cost. This is going to be called your maximum out-of-pocket cost for covered medical services, unlike original Medicare. Original Medicare does not have that stop loss of payment for out-of-pocket cost. So with a maximum out-of-pocket, the way it works, and you probably had this with some prior insurance that you had maybe through work, once you spend so much out-of-pocket in your co-insurances and your co-payments, once you meet that amount, the plan is going to kick in 100% for the rest of the year. So that is, it's a good feature to have because it does help you if you were to have a catastrophic health event and had several out-of-pocket costs. Original Medicare does not have that safety net. So what's the bottom line? Part C or Medicare Advantage combines Part A and Part B benefits, and usually Part D into one plan. So it makes it this nice, neat insurance plan for most people. It's going to be very comparable to insurance you had when you were working. It's going to be your hospital, your medical, and your prescription drugs all in one card. Everything goes through one company. You don't have to call 2 or 3 different places to find out what's going on with a claim or with a prescription. You've got one company in most cases you're dealing with. So there are plenty of options, and we can help you weigh them. So how to choose your plan. So some questions to consider when you're looking at what plan is going to be best for you. You know, what monthly plan premium can you afford? We're seeing a lot of plans nowadays have a $0 premium, and that is because they are being paid for with your Medicare premiums. So the insurance company is taking on your Medicare plan for you, and they're administering it now for you if you go with a Part C plan. So a lot of them are at a $0 plan, which was going to give you some savings on adding a premium, but then you do have plans that have some premiums that offer some extra benefits that you may not see with the $0 plans. So you really want to look at what premium you can afford, and does the plan cover the services that you need? And most importantly, you really need to look at if you can see the doctors you want and if your prescription drugs are going to be covered. So most plans, that's how they're going to vary the most, is by provider network and drug formularies. And those you should be able to look up at any point, either with the insurance companies you're looking at or on Medicare.gov. It's a great way to compare options in your area. And of course, you can always give us a call here as well, and we can help you look at the options we have. Now, prescription drug plans, we are going to talk about a little bit more. They're also, if I haven't mentioned, offered through private insurance companies. So there's really 2 paths to get Medicare. As I was saying, when you take an Advantage plan, they are going to basically deliver your Medicare for you. So you can go with original Medicare, which is your Part A and your Part B. You have to get Part D separately as a standalone plan. And then you can also add on a supplement insurance or a Medigap plan if you would like, which will help cover the out-of-pocket costs that original Medicare does not cover. And that's the only thing that they cover. We will talk about those a little bit further on. Now, Medicare Advantage combines your Part A hospital, your Part B medical, and most plans are going to include prescription drugs. So if you need prescription drug coverage, you're going to want to pick a plan that has that. Medicare Part D, if your plan doesn't include it, you may be able to join a separate Part D plan in some cases. So if you choose a Medicare Advantage plan, here are the 2 options. Or 2 of the main options that you're going to see. You have a health maintenance organization, also known as an HMO. And I can't say enough, don't be afraid of an HMO. If your doctors are all going to be in network, it's going to keep a lot of your costs down in most cases. So an HMO can be a great plan for many people. Sometimes they have additional benefits. You might need to have a referral to see a specialist, but in most cases, you're probably seeing a primary care provider who's handling your referrals already. Now, if you go with a preferred provider organization, also known as a PPO, you can use doctors and hospitals outside of the network, but often that's going to be at a higher cost share for you. So by staying in network, you will always keep your costs lower. So what costs do Medicare Advantage plans cover? So earlier on, we talked a little bit about the benefit period deductible with Part A. Currently in 2022, that is $1,556 for your initial 60-day benefit period. Now, a benefit period deductible is a little different than an annual deductible. It is going to only cover you for that 60 days with the same type of service. So if you had maybe a second hospitalization during the year, outside of that time, you would incur an additional benefit period deductible. Part A also has $194.50 per day coinsurance for skilled nursing facilities for days 21 through 100 currently for 2022. So you would have co-payments on skilled nursing. Those are just a few that we look at for Part A. With Part B, the main ones you really look at is the annual deductible for Part B. This year in 2022 is $233. Once that's met, Medicare Part B is going to cover 80%, and you'd be responsible for 20%. I know for a doctor's appointment, 20% might not be too heavy of a bill. However, once you start thinking about a $50,000 outpatient surgery, a $12,000 MRI, 20% can add up pretty quick. So it's very important to always have another option, whether it's a retiree plan, a supplement plan, or Medicare Advantage plan, and take a look at how they can help you limit these out-of-pocket costs. Specifically with the Advantage plans, they're going to give you low out-of-pocket co-payments and co-insurance options for those services. Now, Medicare Advantage plans may also include a lot of extras. The main ones that you hear about are dental, annual hearing exams, eyewear and hearing aids, prescription drug coverage, emergency medical care outside the US, and out-of-pocket medical costs are going to have an annual limit. That's that maximum out-of-pocket amount that we talked about earlier. Now, one thing I really want to point out with the Medicare Advantage plans is they operate a lot like insurance you have where you are working. You're going to have coverage in most cases with work insurance. If you're traveling, you're going to have something for emergency and urgent care. Now, with the Advantage plans, you do definitely have emergency medical care in and outside the US. You have access to emergency care and urgent care. And that is something that when you work with a rep, they can always go over with you. It is important to know the difference of needing to see an out-of-network provider if you're possibly living a partial residence in another area, or if you want to go seek a provider in another area. So it is important to learn the differences and definitely speak with whoever is helping you to make sure that they know your specific situation. In our area, we do have a lot of people that live in the southern area of the country for part of the year, and they spend their summers up this way. So we do make sure to go through and check those type of providers and what is best going to fit their needs individually for the areas they're going to. So that's just something extra that you want to make sure you look at outside of provider networks and drug formularies, is making sure you cover any area that you may be living in or visiting extendedly. DSNPs, these are called a dual eligible special needs plan. And what a DSNP is that it is for people who have Medicare and Medicaid. And a DSNP is a specialized Medicare Advantage plan and is created for those who qualify for both of those programs. You must have state Medicaid plan and qualify for a Medicare Advantage plan to be able to get a DSNP plan. So how a DSNP works is Medicare is the primary payer for medical services, while Medicaid is the secondary payer. This means that Medicare is first to pay for covered medical services, and then Medicaid pays for the remaining qualified costs. Some members will have a remaining out-of-pocket costs. This could happen sometimes with low co-payments for prescriptions, or sometimes if you have a partial Medicaid, you may see some co-payments for services as well. So when working with a Medicare advisor, you definitely want to look at if you qualify for a DSNP plan, if you have Medicare and Medicaid together. So much like traditional Medicare Advantage plans, a DSNP can include extra benefits that original Medicare and Medicaid alone may not cover. So this is going to include things like dental care, eye exams, transportation to doctor's appointments, and much more. We are seeing plans now that have extra benefits like healthy food cards, over-the-counter items, things like that. So definitely it is worth discussing with your advisor to see if you qualify for these plans. It's also important to note that coming up next year, it looks like they may be raising the income limits for Medicaid eligibility for people on Medicare over 65. So it would be good to check with your advisor or your local Department of Social Services if you may even qualify for additional programs to help bring your costs down. So Medicaid could be an option. There's also a Medicare Savings Program that can help you possibly pay your Part B premium. And some co-payments and co-insurances. So it's important to check with your local Department of Social Services or your Medicare rep, and they can give you some information on some of those cost-saving programs that you may qualify for. Now we're going to talk a little bit about prescription drugs. So again, just to highlight how you can get prescription drug coverage, Part D coverage, you can either get a standalone Medicare prescription drug plan, known as a PDP, or you can get a Medicare Advantage plan that comes embedded in your Medicare Advantage plan. Now, it's important to note there is a 1% penalty for people who do not sign up for credible drug coverage at the time they first become eligible for Medicare. So when you first take your Part B, you do need to enroll into a Part D plan, even if you're not taking any medications. So that's another good thing about going with an Advantage plan. A lot of times you can find a $0 premium and you have credible prescription drug coverage at that time. But even if you aren't taking medications, it's important to get that coverage because year after year that you wait to take it, when you do take it, that 1% penalty can add up. So we are going to talk a little bit about the different phases for prescription drug coverage. We'll go over what the coverage gap is and kind of how that works. So there's basically 4 stages of prescription drug coverage, and these rules are Medicare rules. So it's not going to necessarily matter what type of Part D or Medicare Advantage plan you choose. When you start out with a plan, you're going to have your stage 1, which is going to be your deductible. So until you have reached your deductible, you will pay the full discounted cost for your covered drugs. Some plans have a $0 deductible, so that may save you, and that might be something to definitely look at when choosing a plan, is if you have an option for a 0 deductible plan with your Part D drugs. Stage 2 is going to be what's called your initial coverage limit. So after you have reached your deductible, you pay only the part of the cost for your covered drugs. So what this means is when you have a plan, you're going to pay the predetermined co-payments or co-insurances that your insurance plan has already decided for you. So if it's a $10 co-payment, your insurance company is going to pay the rest of it. So if you have a $100 drug, you're paying a $10 co-payment, your insurance company is paying the other $90. So when you get to a certain amount out of pocket, a certain amount of drugs altogether between your out of pocket and what your insurance company pays, you are then going to go into stage 3, which is the coverage gap. Now in 2022, that amount that you need to get to is $4,430. So after you and your plan have paid the total of $4,430, you will pay only part of the cost for your covered drugs until you reach $7,050. So what's going to happen in the coverage gap is you're going to pay 25% of the cost of your medications instead of the predetermined co-insurance and co-payment arrangements that you had previously in the initial coverage area. So while in the coverage gap, you are going to continue to pay the 25% until you reach a certain amount of money out of pocket. And in 2022, that number is $7,050. These two numbers change usually year to year. So while you are in the coverage gap, paying that amount out of pocket, what counts to get you to that $7,050 is anything you paid in stage 1 for a deductible, anything you paid in stage 2 for your co-payments and co-insurances. And then when you're in stage 3, the 25% that you're paying out of pocket is going to cover toward that $7,050 number as well. So will, if you are doing a brand name drug and you're getting a discount for it, most of them will carry 70% discount. And a big part of that discount is included in the $7,050 number as if you were paying it, even though you're not. So there is a little bit of savings in there to help you get out of the coverage gap a little quicker in most cases. However, it can be very costly for people. Once you get to that $7,050 number, out of pocket expenses, you're going to go into the catastrophic pricing, which is going to be a set co-insurance or co-payment, which will be much lower for you to get through the rest of the year. Now, it can be confusing. It is best to work with somebody who can take a look at your medications, put them in the system, and tell you exactly what they're going to cost, when you're going to hit the coverage gap, if you will, what they'll cost in the coverage gap and the catastrophic phase. All companies have software that can do that. And you could do that yourself, even on Medicare.gov. You can build a profile, keep your prescriptions in there, and it will tell you exactly with your pharmacy and the insurance company you choose what the cost of your medications should look like for the entire year. You will also get a statement every month from your plan. So whether it's a standalone Part D plan or a Medicare Advantage plan, it's going to have a statement for you, and it's going to let you know where you are with your total drug spend each month. So there won't be a surprise when you show up to the pharmacy and all of a sudden it's a little more costly. You're going to be able to be prepared for that. Now, there's also extra programs that can help you. New York State Epic is one of them. That's a great program. For individuals, you just need to make less than $75,000 for the year prior. And married individuals, $100,000 from the year prior. You do need to be a New York State resident over age 65, though. And eligible to join or be on a Part D plan. So that is definitely an option to help people keep their drug costs a little bit lower. It can, once you reach the qualifying stages for Epic, you can keep your co-payments in most cases under $20 a month. Now, there's also extra help through Social Security that is based on income. You can find that information at ssa.gov or by working with a Medicare advisor. And that is going to base your co-payments based on your income level. So that could also be a very good option for many people in keeping their drug costs lower, and it would maintain lower costs during that coverage gap too. So certainly if you have questions on how prescription drug coverage works, you will want to reach out to a trusted Medicare advisor and learn a little bit more. Definitely check your prescriptions. It's very important to know how they will work for the year. Now, Medicare Part D formularies, if you're not familiar, a formulary is a list of covered drugs based on the most used Medicare prescribed drugs. A plan formulary may change at any time. You will receive notice when necessary, though. So if you're taking medication that's being changed, you will be notified. For the most up-to-date formulary, you're going to want to visit the plan's website or call their customer service phone number. So again, you can do a lot of this stuff yourself, and it's very important to know your own information and know what is going to be the best option for you. And then you can always meet with a plan or a trusted Medicare advisor who can just kind of verify a lot of that information for you. So Medicare supplement insurance, also known as Medigap. So supplement insurance is sometimes called MedSup or Medigap. So original Medicare covers about 80% of Part B services. A MedSup can help you cover some of the out-of-pocket expenses like deductibles, co-insurances, and co-payments. Medigap plans are also sold by private insurance companies, and these help manage some out-of-pocket costs, again, such as the deductibles and co-insurances. They don't include Part D coverage. You have to buy that separately. It's also important to know they don't cover anything outside of original Medicare. So no vision, no dental, no hearing. Benefits like that are not included with original Medicare. Now, they do cover visits to any doctor who accepts Medicare patients. So again, just very important to know that the MedSup plans are going to cover out-of-pocket costs that original Medicare does not cover, and that is all that they do. So they will work with your original Medicare, and then you will need to get something for credible drug coverage if you choose to go with a Medigap plan. Now, the next steps are just bringing everything together. So step one, you're going to want to enroll in your Medicare Part A and Part B when you first are eligible. Step two, there's really two ways to proceed with your Medicare, and it's just kind of figuring out which one is going to be best for you. Do you keep your original Medicare and add a Medicare supplement insurance and a Medicare Part D plan? Or do you go with a Medicare Advantage plan that's going to combine your Part A, your Part B, and often your Part D and additional benefits? So some of the frequently asked questions that we do get are in the next few slides. So I'll go through them briefly. But how do you enroll in Part A and Part B? So really, Social Security, you have a couple of options. You're able to contact them through their phone and do a phone appointment with them. Most, I believe, you're able to go in for in-person appointments again, which is great news. And SSA.gov is a great tool for enrolling in your Medicare, just because you are able to then get back in and see all of your information. So you'll see anything that they've mailed to you, I believe. You're able to track your application. One thing that is important to point out is that you also will want to, if you are getting Social Security, when turning 65, you're going to automatically receive your Medicare card and be enrolled in Part A and B. So if you are on Social Security before turning 65, it will be automatic. If you are on Social Security disability, it'll be automatic when you reach your 24 months of coverage. Now, if you're not collecting Social Security, you will need to actually go and apply. Let's see. When can you enroll in Part A and Part B? So you can enroll in the window of 3 months before the month of your 65th birthday, all the way to 3 months after your birthday. So you have a 7-month window for the time that you can enroll in your Part A and B. This is called your initial enrollment period. So if you don't enroll in your initial enrollment penalty, and you should have, because you don't have a credible reason not to, then you could face a higher premium by having a Part B penalty. In addition, then you're going to want to take a look at any special enrollment periods that you may have down the road if you choose not to enroll. You may have to follow certain times where you can enroll into your original Medicare. So if you miss a special enrollment period and you don't enroll in your initial enrollment period, you would have to do the Medicare open enrollment period, which is January through March every year. You can enroll during that time. Your penalty will be assessed in most cases because you would have gone some time without coverage when you should have. And your benefits will not begin until July 1st of that year. So definitely some planning around when and how and if you're going to take your Medicare. We do always recommend looking probably at least a year out, sometimes even further. It depends if you have a spouse or children that you are having employer insurance for too. So there's a lot of factors that go into if and when and how you're going to enroll in your Medicare. When can you enroll in the Part C and Part D? So during the same 7-month window in your initial enrollment period for Part B is the same time that you are able to enroll initially into a Part C and Part D plan. So are there other times that you can enroll in a Part C and D? So from October 15th through December 7th, all people with Medicare can change their health plans. These plans will take effect January 1st when you make a change during that time. You can also switch to a Medicare Advantage or original Medicare during this annual enrollment period. You can join a Medicare prescription drug plan or change plans also during this time period. Another open enrollment that I like to point out is Medicare Advantage open enrollment, which is going to be January 1st through March 31st each year. And as you can see, there's also other times you can enroll. They're called special enrollment periods or SEP. Losing your employer coverage is a special enrollment period. So when you retire or when you choose to leave your insurance and go onto Medicare, that gives you an 8-month window where you are able to enroll into Medicare and an Advantage plan at that time. Moving to a new service area. Again, these are very regional plans. They're going to, in most cases, be based on the county you live in. So if you move one county over, you might be able to keep your plan exactly as it is. However, in some instances, even moving one county away can change your options. So moving does allow you to change plans. Qualifying for something like Extra Help or Medicaid is going to allow you to change plans. And I love New York State Epic as a special enrollment period because that lets people as well, one time per year, change their coverage if they need to outside of open enrollment periods. You never know when your health can change or when you may need to choose a different plan. So what if you're late signing up for Part B again? Again, there is a 1% penalty with that. The penalty increases based on each month that you delay. So this can get costly. It can add up. When can you enroll in a Medigap, or also known as Medicare Supplement Insurance Plan? So Medigaps have a 6-month open enrollment period in most states. It automatically starts the first month you are 65 and enrolled in Medicare Part B. So for example, if you turn 65 on April 3rd, but don't join a Medicare Part B until May 25th, your Medigap open enrollment period will start on June 1st. This is the first day of the month in which you are both 65 and enrolled in Part B. During your 6-month open enrollment period, you can buy a Medigap policy sold in your state. In New York State, things are a little different. You are able to apply at any time during the year into a Medicare supplement plan, and you can go back and forth between a supplement and an Advantage plan. In New York State, we have what is called community rating. So you do not pay for Medicare or Medicare supplement plans or a Medigap plan based on underwriting of your health and age currently. So it is based on regional pricing, or community pricing is the better term for it. So if you leave a Med Sup plan and go to a different option for a while and you come back, chances are it might be the same amount still if your plan has not gone up just due to raising premiums. So again, reach out to a trusted Medicare advisor to learn more about the differences with Medicare supplements and Medicare Advantage plans and your Part D plans, and when all those different enrollment periods are, because that can make it a little confusing. It is important to know that if you do switch to a Medicare supplement plan, you will need to pick up a prescription drug Part D plan, and they do follow certain enrollment periods here when you're changing. Let's see, Medigap policies help if you have health problems. During 6-month open enrollment period, you can purchase a Medigap policy even if you have pre-existing health conditions. So that is important to know that you do need to have consistent insurance when you go to a Medigap plan. Because if you do go for a period where you don't have coverage, you could, there is a pre-existing condition clause. But in most cases, as long as you've had continuing coverage, you will be able to continue on with pre-existing conditions. Even if you have a disability or health problems, an insurance company cannot do any of the following. They cannot refuse to sell you any Medigap policies it offers. It can't charge you a higher premium than they charge others who are 65 or older, and they cannot delay the start of your coverage. Same thing with the Advantage plans. I actually had somebody the other day ask me if their health changed with a upcoming anticipated diagnosis, if they would be able to enroll or if it would change things, and it will not. You are still able to enroll in the plan of your choice. So what if you delay enrollment in a Medigap policy? You can apply for a Medigap policy after your open enrollment period ends. However, there are no guarantee your application will be accepted if you don't meet the medical underwriting requirements, except in certain limited situations. Again, in New York State, there is not the underwriting requirements. So that's just something to keep in mind. So if you're able to buy a Medigap policy, there may be additional costs in the form of a penalty. You incur this penalty from Medicare, not Aetna. So again, we don't have a lot of those requirements here in New York State. So if you are looking at Medigap plans, definitely reach out to a trusted advisor so you can find out, again, any specifics around enrolling in those Medigap plans. So time to review our Aetna Medicare benefits. So that's one thing that we do like to point out, that if you are interested in looking at some of the plans, that we're here to help you with that. Now, you can enroll in a Medicare plan during your 7-month initial enrollment window. You can also enroll or change Medicare plans during AEP, which is October 15th through December 7th. So that's coming up. I know it's a time that's a little crazy for everyone. It just kind of shows up, and some people don't realize that they don't have to make a change if they're happy with the plan that they have currently. It's not something you have to re-enroll in every year. You just stay put. Unless your plan has notified you that they're ending or changing, and that sometimes can happen. You are going to want to take a look at your plan options and make sure that your plan is fitting your needs. Every year, in fact, you should already have them. You get what's called an ANOC letter, which is your annual notice of change. So the plan that you're on currently, your Part D or Part C plan, is going to give you information on what the plan is going to look like for the coming year. So you should already have that information for 2023. You can decide if your plan fits your needs, or if you want to take a look at some of the other plan options in your area. So you are able to contact us directly at Aetna for a local representative, and we can help you determine some of those options. You can visit Medicare.gov, which I highly recommend. Build a profile, keep track of your medications and your providers and your pharmacy and all that stuff. I would not choose just because it comes up as the first plan, because you really need to look at what I call the meat and potatoes of the plan. Sometimes it will be a good sort for you. The first probably 10 to 20 plans that come up, you can really narrow them down by carrier and what each one has to offer in your area. But doing so by sorting your medications will certainly help you pick a plan that is going to fit your needs best. Everybody has something that's important to them, whether it's their prescriptions that they take and they're really expensive or they're hard to get, or they have a specialist that they have to see, or maybe they see physical therapy regularly, or they need dental. Everybody has a different need, and you're going to want to look at plans based on what your needs are. And believe it or not, people in the same house can have different plans. We'll have a spouse that has one type of plan and another spouse that has maybe a Medigap or even just a different carrier altogether. So again, everybody's Medicare is an individual need. You can also call 1-800-Medicare 24 hours a day, 7 days a week. And I cannot stress enough, Medicare is not going to call you and tell you to enroll. If I can leave you with anything, do your best not to answer the phone calls that you probably are getting, some of the mail you're getting, and don't call. The phone numbers on the TV would probably be the best advice I think anyone could give you. Unfortunately, you may be getting someone who's not even in your area, and some of the people that are calling you could even be fraudulent. So it is unfortunately a very targeted time for you during the AEP. So I would do as much research as you can on your own and work with a trusted advisor in your area, somebody who's local that has a reputation that somebody can verify is probably the best way to go. And I know a lot of people have people now that they are working with, which is great to hear. And you really need to pick what plan is going to be best for you. Somebody should just kind of lay out your options and help you understand them. And then you need to know how your plan works and how it continues to work to serve your needs. And if it doesn't, then you may want to take a look at other options. And that kind of concludes what we have today. So I do thank you for listening to me drone on about Medicare. I know it's not a very exciting topic, but hopefully we are able to help you. We do cover all of, we do cover all of New York, but myself and I cover central and upstate New York. So I believe Jess will have some contact information where you can reach out. I have email. My phone is a phone you can text. So I definitely welcome anyone who has questions to go ahead and reach out. And we'll see if we can't help you. Thank you, everyone. Have a good day.
Well, thank you so much, Erin. That was so informative and generous. On behalf of the YMCA of Central New York, we just really would like to thank you for sharing this educational content with us and allowing us to better support our community and members. As Erin mentioned, we're going to put up a slide with Erin's contact info. So if you would like to get in touch with her to learn more, please do so. And you can always reach me at virtual@ymcacny.org. Thank you so much to all of you from wherever it is that you are listening. We're looking forward to seeing you soon. All right. Bye-bye, everyone.